PP desire हो रही है,
PPD upload
yes,
हो
but
गई.
it is not completely uploaded because it is taking a time. Now I will start uh, from the uh, first slide to onward, and the diarrhea. This is mostly observed illness in the animals, major cause of economic loss to the cattle industry um, due to a diarrhea, and leading cause of death in cattle heifers. This is a 6.6 dairy heifers uh, die due to a diarrhea, and beef calves is 5.6%, aged less than 4 months are dying. 45% of the total loss of a dairy industry in the India, whereas the significant cause of economic loss in cattle industry with a mortality in calves up to 54% is observed in the due to a diarrhea in the calves, and as well as in the uh, buffalo and the cows. Diarrhea has a variety of causes. One is the infective as well as a non-infective. So the infectious agents play a major role in neonatal calves diarrhea. So the diarrhea is defined simply as a passage of a feces that contain an excess amount of water. This results in an abnormal increase in stool liquidity and weight. In some patients, there may simply be an increase in the frequency of a defecation. So the diarrhea has also been described in broad, simple terms as the too rapid evacuation of a too loose stools. So definition notwithstanding, however, it is most important that the clinician carefully determine exactly what the owner means when the term diarrhea is used. So diarrhea may be a small intestine diarrhea or a large intestine diarrhea. The clinical sign in the cause has been seen more than 3 to 5 days old. The anorexia, elevated body temperature, depression with varying degree of dehydration, increased heart rate, watery to semi-solid feces and dehydration, hyperkalemia, metabolic acidosis, and azotemia, hyponatremia, isokalemia, hyperchromia, and hypoproteinemia. Calves from 4 days to 2 months old may manifest with diarrhea or primarily as a dysentery with blood and mucus feces. So that might be due to a Salmonella species, Salmonella trifimurium and Dublin. In calves 2 to 12 weeks old, produces enterotoxins, causes inflammatory changes in the intestine and bacteremia. Clostridium perfringens type B and C, most common cause of a cough enterotoxemia. Hemorrhagic enteritis with ulceration of the mucosa, fetid, blood-tinged diarrhea, dysentery, abdominal pain, convulsions, and opisthotonos. Death may occur in a few hours, but less severe cases survive for a few days and recovery impossible. So mostly the clinical signs which are being observed, that is the feces may have a mucus. That might be, if it is a small intestine diarrhea, then it must maybe rarely present in the mucus in the feces. If it is large intestine diarrhea, then frequently the mucus is present. Volume, that may be increased if it is in the small intestine diarrhea, but normal to increased if it is large intestine diarrhea. Quality of stool must be varies from uh, nearly formed to uh, quite watery, often appears soft for and couple indigested food for double globules may be present, um, moderate. Loose to nearly formed mucus is absent and might be are present in a small amount or constitute nearly this entire volume of material expelled to malignant. So the shape might be the terre vary depends on the amount of water present in the feces, and it may be a normal in a large intestine diarrhea. The stony area may be present, but it is absent in the large intestine. Color may be considerable variation from to a dark brown and black, uh, not always uh, melanoma gray, whereas it will maybe a variable, usually brown, maybe rarely clear. So the melena might be present in the small intestine area, whereas melena is absent in the large intestine area. Whereas the hemorrhagia is absent and may be present in the large intestine area. Frequency usually increased in 2 to 4 times in a day, but maybe remain normal in some patients. Almost always increased may be frequent as a 3 to 10 times per day. Average is 3 to 5 times. The continuous, it is frequently increased if it is a large intestine diarrhea. Dysphagia is absent where it is frequent in dogs and less common in cats. Tenesmus is absent in a small intestine diarrhea where it is frequent in dogs but less common in cats. Urgency may be present in case of a acute diarrhea, and severe enteritis may be observed in the small intestine diarrhea, whereas the frequent common reasons for the in the large intestine diarrhea. Whereas the vomition, the dogs and cats may have to vomit, and common in patients with inflammatory bowel disorders and acute infections. May occur in a 30 to 35 of the patients who, with acute colitis. Sometimes occurs before and of the abnormal stools. So the appetite usually normal or decreased may be cyclic, whereas the usually remain a normal may be decreased of a disease in the large intestine diarrhea. Weight may be lost in the small intestine diarrhea uh, are usually may occur in the conjunction with the severe colitis. If there is a severe colitis in a large intestine diarrhea, then the weight will be lost. The halitosis may be associated with the maldigestive and malabsorptive tissues, and it is absent in the large intestine diarrhea. Barbo, barbigamous may be present in the small intestine, and it is absent in the large intestine. Flatulence may be normal or absent. The fecal incontinency rare, where may be present in the large intestine diarrhea. Schooling or chewing perianal areas absent in the small intestine, where it may be present in the large intestine diarrhea. Mostly the causes might be in the large animals, especially the cows and buffaloes are in the calves of the cows and the buffaloes. There might be a rotavirus, there might be a coronavirus, there might be a bovine virus uh, diarrhea, and bacterial scour may be due to enterotoxemic E. coli, Clostridium perfringens, Salmonella species, Proteus species or Pseudomonas species may cause diarrhea in the cows. That might be due to a protozoa, Emeria species or Cryptosporidium species may cause the diarrhea in the cows, whereas the predisposing factors in the cows or buffaloes or in a goat and sheep is inadequate nutrition of the pregnant dam, inadequate environment for the newborn calves, inadequate colostrum ingestion, inadequate immunoglobulin absorption from the calf ducts, guts, poor hygiene and overcrowding or mixing of a different age groups may cause the diarrhea in the cows. E. coli has been frequently implicated as the primary bacterial cause of, in the calf scores. Isolated enteropathogenic E. coli from 90% diarrheic calves in an organized farm has been seen. Most common cause of a diarrhea in cows aged up to 4 months in presence of a regular deworming and adequate management conditions. अगर आप deworming भी करते हैं तब भी E. coli can cause a diarrhea in the cows. There are 5 Escherichia coli which may cause the diarrhea. One is the enteropathogenic, enteroaggregative, enterotoxigenic, enteroinvasive, and Shiga toxin producing E. coli can cause the diarrhea in the animals. The the diarrhea due to a small intestine that might be due to the difference in the diets, that might be due to extra gastrointestinal diseases, infection in the small intestine, inflammatory or immune-mediated conditions may cause the intestinal diarrhea, small intestinal diarrhea. Idiopathic or neoplasia may cause intestinal diarrhea. Partial obstruction or motility disorders may cause the small intestine diarrhea, or small intestine diarrhea may occur due to drugs and toxins which are taken by the animals. The large intestine diarrhea may be due to a difference in the diets. Extra-intestinal conditions may cause the large intestine diarrhea. Infections may be the etiology of the large intestine diarrhea. Inflammatory immune-mediated diseases may be the cause of a large intestine diarrhea. Idiopathic neoplasia, obstruction, or miscellaneous causes may produce the large intestine diarrhea, or the drugs and toxins may have to cause the large intestine diarrhea in the animals. Small intestine diarrhea may be due to a diet intolerance. Food hypersensitivity may cause the intestinal diarrhea. Food intolerance, gluten sensitive enteropathy may be the reason of the intestinal diarrhea. Extra gastrointestinal diseases like EPI, hepatic diseases, hyperthyroidism, hypoadrenocorticism may be the cause of the small intestine diarrhea. There might be the infection in the small intestine, bacterial infection, helminth infection, protozoal infection, or a viral infection may be the reason of a small intestine diarrhea. Small intestine diarrhea may be due to inflammatory or immune-mediated Bessenji enteropathy, duodenal ulceration, hemorrhagic gastroenteritis, inflammatory bowel diseases that might be due to a eosinophilic granulomatous or lymphoplasmocytic. So the protein loosening enteropathy or a nephropathy of the soft-coated Wheaton Terrier in the dogs, idiopathic or a lympho uh, Jesheskia may be the cause of the uh, disease of dogs. The large intestine diarrhea in the dogs and cats may be due to a dietary hypersensitivity, dietary indiscretion, extra-intestinal conditions like metastatic neoplasia, neurological disease leading to ulcerative colitis, pancreatitis, toxemia, uremia. Infection may be due to a bacterial reasons, may cause the small, large intestine diarrhea in the dogs and cats. That might be a clostridium, that might be a E. coli, that might be a salmonella, and that might be a the clostridium or a Yersinia. So the large intestine infection might be due to a viral infection that might be a coronavirus, feline immunodeficiency virus, feline infectious peritonitis, feline leukemia virus, or parvovirus. The parvovirus may be in the dogs and cat, and both may occur, whereas the feline immunodeficiency occurs in the cat, feline infectious peritonitis occurs in the cat, feline leukemia virus is present in the cat. Fungal infections like histoplasmosis or prothocosis may be the reason of the large intestine diarrhea in the cats and the dogs. Parasitic infection may be the reason of the diarrhea of a large intestine like amoebiasis or ankylostoma, blantidium, or cryptosporidiosis, Gardia. These are the parasitic infections which may cause the uh, diseases, large intestine diarrhea in the cat and dog due to roundworms, tapeworms, trichomonas, fetus, or uh, Unseenaria, or whipworms. So the protozoal diseases may be the reason of a large intestine diarrhea, that is plasmosis that might be present in the cause of the large intestine diarrhea in the dogs and cats. Large intestine diarrhea in the cats and dogs may be due to immune-mediated inflammatory disease, histiocytic ulcerative colitis, uh, especially found in the boxer species of the dog, inflammatory bowel disease like idiopathic conditions, fiber-responsive large bowel diarrhea in the dogs and cat, irritable bowel syndrome in the dogs and cat, neoplasia that might be a benign or a malignant, that might be a benign, maybe a adenomatous polyps, leiomyomas, or adenocarcinoma or lymphoma might be the malignant tumor which may have to lead with a large intestinal diarrhea in the dogs and cats. The large intestine diarrhea in the dogs and cats may be due to obstruction like a cecal inversion, foreign body presentation, intussusception, neoplasia, structure, or miscellaneous causes may cause the large intestine diarrhea like a secondary to chronic small intestinal diseases or stress may cause a large intestine diarrhea in the dogs and cats. The large intestinal diarrhea in the dogs and cats may be due to the drugs and toxins like acetozolamide, atropine, allopurinol, aminophylline, amoxicillin, amphotericin, ampicillin, antinolone, benzalkonium chloride, bethanocol, blue-green algae, borax, calcium acetate, carbamide insecticide, cardiac glycosides, or cephalexin, chloramphenicol may cause the large intestine diarrhea. There are so many drugs and toxins which may produce the large intestine diarrhea like chlorophenamine, uh, cholicine, uh, cotonester, and there is even a cyclosporine, cetarabine, daffodil, diazoxide, diclofenac sodium, deferbachia, deoxycycline, uh, glyphosate, or even a honeysuckle, horse chestnut, ibuprofen, indomethacin, iron salts, and libermin can cause the large intestine diarrhea. Lactulose, levamisole, lithium, loperamide, mebendazole, metaldehyde, or methocarb, or misoprostol, mistiato, or metotoin, or even a naproxen, or nicotinamide, NPK fertilizers, NSAID ingredients, or organophosphates, or oxytetracycline can cause a large intestine diarrhea in the dogs and cats. Even a pimidrominate or even a pancreatic enzyme supplementation, paracetamol, paraquat, or even a pendoxyphenyl, or a petroleum distillates, or a phenoxy acid herbicides, or a peprazine, or a poinosacea, or a procainamide, or a pyracantha, or a parenthine, or a parathyroids, or a pyridostigmine, or a quinidine, rhododendron, or salts may cause the large intestine diarrhea. The drugs like selective serotonin reuptake inhibitors, sotalol, theobromine, theophylline, vitamin D, rodenticides, or U and zinc sulfate can cause large intestine diarrhea. How to diagnose the diarrhea in the uh, dogs, cats, or even in large animals? The isolation and identification of a bacteria can give us the confirmed diagnosis of the diarrhea, and then the sensitive test can give us a confirmed treatment of the diarrhea in the large animals as well as small animals like dogs and cats. Approximately 1 gram of the fecal sample is isolated in a 10 ml of a buffer peptone water and incubated at 37 centigrade for 18 hours. A loop full of enriched inoculum would then be planted onto a eosine below agar and mcconky agar. Inoculated pellets are incubated at 37 centigrade for 24 hours. The presumptive colonies will be subjected to a further confirmation for a biochemical characterization. So this is the colony characterizations on the EMB agar and McConaughey agar. Whereas the Salmonella isolation can be pre-enrichment in a non-selective medium, buffered peptone water, a selective enrichment in a tetrathionate broth, Muller coffin or a report. Vesiliadis soy peptone broth may be used, and then you can see that the characteristic colonies can be observed in the petri dishes after the growth. Biochemical characterization can be carried out by taking a 3 ml of a peptone water containing a tryphone at 37 centigrade for 48 hours, and then 1 ml of a diethyl ether is added and shaken well and allowed to stand until the ether rises to the top. 0.5 ml of a Kovac reagents is gently run down the side of the test tube to form a ring in between the medium and the ether. So you can see this will be the indole which will be created, and that is showing the negative and the positive samples chemically. The methyl red also can be seen that the negative will be the yellow and the brown will be a methyl red solution, maybe red in the positive cases. Whereas the Vagos Pencor test can also give us a negative in a yellow and positive in a red color, whereas the carbohydrate fermentation test also give us a negative in a red color, positive in a fermentation, and even a fermentation with a proteinuria side. So the catalase test also can be observed that 3% of the catalase reagent can be taken and then see and observe the positive on the basis of a color. Citrate utilization test can be performed for 24 hours. You have to keep on the 37 centigrade and then see that the positive might be the green one. And biochemical characteristics of E. coli can be seen by changing a color of the tubes, and then the positive and negative can be declared on the basis of their decoloration. Biochemical characteristics of salmonella can be also seen in the same way. Biochemically, the change of the color will indicate the positive and negative samples of the uh, feces. So treatment will be the fluid therapy for water and electrolyte replacement and correction of acid-base disturbances, alteration of the diet, and antimicrobial and anti-inflammatory therapy can give us a positive results. So the fluid therapy might be a saline, lactose, or a dextrose can be given, and electrolytes may be like a Nova Coke or like the correction of the acid-base balance can be carried out by giving a carbohydrate. Bicarbohydrate or alteration of the diet can be prescribed, that the animal may be kept on the other diets which is not which is causing a disease that must be stopped, and antimicrobial the drugs should be started and anti-inflammatory therapy may be given. So protozoa is one of the cause of the diarrhea in the dogs and cats. 19 species and 40 genotype cryptosporidium is the cause of the diarrhea in the animals. So the cryptosporidium oocytes can be seen and detected in the feces up to 70% 1 to 3 weeks old dairy calves, and infection can be detected as early as 5 days of age, with the greatest proportion of calves excreting an organism between day 9 and 14. So many reports associated infection in a cause with a diarrhea occurring 5 to 15 days of age. Immunocompromised animals are more susceptible to clinical disease than immunocompetent animals. Source of a cryptosporidial infection is a oocyte that are fully sporulated and infective when excreted in the feces. Mild or to moderate diarrhea that persists for several days regardless of a treatment. Feces are a yellow, or a pale, or a watery, and contain a mucus. In most cases, the diarrhea is a self-limiting after several days. The, the persistent nature of the diarrhea leads to a marked energy deficiency in these circumstances, and the calves die of a inanition at 3 to 4 weeks old. The detection of oocyte by examination of fecal smears with a Ziehl-Neelsen stents, fecal flotation test, ELISA, fluorescent labeled antibodies, or a rapid immunochromatographic test or PCR can assist us to diagnose the cause of a disease by utilizing these techniques. The wet smear technique: take a clean glass slides, add a 1 drop of a water and mix with a loop full of a feces. Add a 1 drop of a malachite green on it. Cover with a cover silk and observe under a microscope at a 40x. So this is the modified Ziehl-Neelsen staining. The make a fecal smear on a glass slide, heat fix it, then fix with alcohol, cover the smear with a carbol fusin for 30 minutes and wash with a distilled water, uh, destain with a acid alcohol, wash with a distilled water, counter stain with a methylene blue for 5 minutes, wash, dry and observe under the oil immersion objective. So this is the crypto
Okay.
oversights which can be seen on the IL immersion on the 100x. The control can be the diarrhea can be controlled by the cause should be given in a clean environment. Adequate amounts of a colostrum should be fed at an early age. Cows should be kept separate without calf to calf contact for at least the first 2 weeks of a life with strict hygiene at feeding. Di- diarrhea cause should be isolated from a healthy cause during the course of the diarrhea for several days after recovery. Hyperimmune bovine clostridium can reduce the severity of a diarrhea and the period of oocyte excretion in experimentally infected cows. Many research groups have attempted to develop the effective vaccine against the cryptosporidea. Unfortunately, to date, vaccination have not been effective. Emirai bovis or Emirai zoni, bloody mucoid diarrhea is often seen 1 to 2 days before a one oocyte are shed. Pre-patent period is 16 to 70 days, peak oocyte production at the 3 weeks, and patent period is 2 to 3 weeks, then self limits. So the body, bloody, mucoid diarrhea, epithelial mucosal layers, dehydration, depression, tenesmus, acial rectal prolapse, seasonality disease, most common in fall, least summer, a highly pathogenic from the disease, winter coccidiosis of a unclear epidemiology occurs, acute death by 5 to 7 days. Others develop the secondary enteritis, pneumonia. A few linger in a poor condition and are culled. And this is the diagnosis of fecal smears can be taken for the diagnosis of the diarrhea and the causative organism. So the oocyte can be seen on the slide. The diagnosis for the uh, cause that might be by gross pathological findings in the colon and rectum, evidence of a hemorrhagic enteritis with a frank blood and a mucus is the one of the evidence that may have to be observed as a causative agent of a diarrhea. So the treatment can be given by chemotherapeutic agents like sulfadiamidine that can be given for a treatment 140 mg per kg body weight, whereas for prevention it can be given a 35 mg per kg body weight for 15 days. Uh, Amprolium may be given 10 mg per kg body weight daily for 5 days as in a treatment if there is a diarrhea. For a prevention, it can be fed 21 mg per kg body weight for 21 days, whereas the monensin can be given a 3 mg per kg body weight for 20 days, and in a prevention, it can be given a 33 grams per ton for 31 days, whereas the lasolacid may be given as a 3 mg per kg body weight, and it can be preventively for the prevention of the diarrhea. It can be given in the feed 40 mg per kg of a starter from 3 days to 12 weeks. For a control of the diseases, especially the diarrhea, the treatment to prevent incubating new cases and reduce the oocyte shedding, a multiplier effect, clinical signs are seen after the damage is done. So treatment until the infections self-limit or immunity may develop. So the oocyte live for 1 year at a 4 centigrade, resist mild freezes, the sunlight, and dry heat kills the oocyte in 4 hours. Provide a clean, dry condition, reduce stress, crowding, do not feed off ground or follow the probable heavy contamination. So thank you very much. This is the uh, completed topic, and I have concluded the diarrhea, and then I'm taking your attendance, and then I have to leave you, and then I have to take the class of a MPhil student. So therefore, I'm leaving you over here, and I'm concluding this one without. So I'm ending a meeting, and then I have to join
Excuse me,
my
sir.
next class, uh,
Excuse me, sir. I have a question, sir.
which is for